The Child Psychiatry Fellowship here at U of L is wonderful in that it's well-rounded. Trainees come here and get to do such a host of different things, from inpatient psychiatric work to consultation liaison work at the Children's Hospital to outpatient work, administrative work. They'll do some medical specialty work. There are just so many different experiences that can be had here.
Our program is a relatively small program. We have 3 residents per class. We value a balance between psychodynamics and psychopharmacology, and so we have a pretty well-rounded faculty to be able to teach that. We are located within the Department of Pediatrics, which also gives us a unique opportunity to be able to treat patients and learn from colleagues in general pediatrics and in pediatric subspecialties that are caring for the same patients that we have.
As a previous fellow, I feel like this is an excellent program where we can get all the different experiences working at inpatient, outpatient, ER setting, consultation and liaison, autism center, and endocrinology, and with even child neurology.
And this is a program that trains physicians really well to be practitioners of psychiatry, that you develop excellent skills to provide care for patients and families. You see a wide array of patients. We have patients from an urban background, a suburban background, rural background. We have a number of patients from other countries. So learning the basics of providing care for different families and individuals, this is the place to do it. You get a really nice background.
We do get to see a huge variety of patients, different pathologies, different patient populations. So we get a bit of that. We go to eating disorder units as well, IOP. So it's a good combination, good exposure, ranging from the elite population to more underserved. So I think it's a good mix.
We also get access to people who are at the top of the field, specialists, and we can really benefit from learning from them here.
We do offer some unique things that some programs in the country may not have access to, such as rotating at an autism-specific center. We have faculty who do sort of their own niches. We have folks who are involved at a state level, working with foster children and helping de-prescribe and manage their high needs. So I think we bring variety of what our attendings give and some of these unique experiences that put us in a pretty competitive place when compared to other programs.
One of the most unique experiences that we've gotten here is being able to be with a child freestanding hospital, which means that we have much more pathology and things like that we're exposed to when we have our consult service, and we get to work with the pediatricians and the internal medicine and all of these different services.
The University of Louisville as a whole, the School of Medicine, is known nationally for a focus on diversity and inclusion, and I think that has trickled down to each department, and I think we've tried to incorporate that and integrate that in our educational experience.
One of the unique qualities of the program is that psychology and psychiatry are together in the same division, so we collaborate every day. It's nice to be able to reach out to each other and talk about cases that we either share or just that we need help with.
We love to get together when we can. It's like a family, pretty much. I feel very comfortable going to either my psychiatry or psychology colleagues whenever I have a question, if I feel like I'm stumped or something, and they're always there to offer a fresh perspective.
No one here is above or below another in terms of working together and trying to help our family and patients that come to us for their needs.
Really, with a lot of our faculty here, they really treat us as co-colleagues. They welcome a lot of our past experiences and are really open to learning about kind of the value that those past experiences bring to kind of us now transitioning to this setting too. So that's been really refreshing as I've kind of adjusted to being here.
All of the residents seem to be genuinely happy with what they were doing. A lot of the other programs that I interviewed with, some of the residents you can kind of pick up on that they might have been a little bit overworked in things, but this program seemed to be really focused on the wellness of the residents and really teaching rather than just using residents and fellows for work.
Louisville's one of those diamond in a rough kind of cities. You get some big city experiences with the arts. Of course, we're the home of the greatest of all time, Muhammad Ali, and you can visit his center. And of course, the fastest 2 minutes in sports with the Kentucky Derby.
My husband and I really enjoy the food scene here in Louisville. I can't tell you the last time I was at a chain restaurant. There's just so much to eat and so much to experience in this city. We also enjoy going to music festivals and other outdoor festivals throughout the summer and spring here in Louisville. There's just always something to do here.
You will be competent to go and work anywhere and do anything. And so if you look at what our trainees have done, we've had those who have started telehealth businesses, who have gone on to complete other fellowships in forensics and addiction, who've joined other academic centers, who've done outpatient, private inpatient, private residential. So we know that our training allows folks to access whatever they want to do because they've seen it and dealt with it and been trained to manage it here.